Thank you for joining us. We have been shining a light on BRCA and inherited risk, predisposition, and higher risk of cancer development over the past few weeks. And we've spoken to experts and to a patient who was diagnosed after she had had her family with both breast and ovarian cancer, and then she found out about her BRCA status. We wanted to bring in a younger woman who you might think is the last person who you'd expect to be affected by ovarian cancer to say a little bit about their story and the kinds of decisions, information, and choices that she has had to make. I'll bring in Laura, and then I'll also introduce Jake, her dad, because as we know, BRCA is something that affects the whole family, and there's a lot of discussions and information that's needed for everyone who's affected. So, Laura, thank you so much for joining us. And I wonder if you could say a little bit about how you were diagnosed, what happened, how old you were, and the kinds of, kind of what you knew before diagnosis about BRCA and what you know now.
Yeah, absolutely. I think when I remember finding out about the possibility that the BRCA1 mutation was in my grandfather's family back in 2015. And what is reflecting on it, what is interesting is, or coincidental is perhaps the right word, is it started to come out that it was in my family. At that point, we knew that a great aunt, a sister of my grandfather, who had tested positive for the mutation, and it was then testing was then kind of rolled out. So my grandfather was tested. He didn't kind of recall hearing about it. Very quickly, we started to see that there were first cousins that had had ovarian cancer. There were other links as well, but I think part of the reason why he didn't kind of maybe know about it was back then there was that misconception of a male can't pass down a mutation to a woman, which we know is completely wrong. My grandfather tested positive for the gene. Coincidentally, and I think we can only say coincidentally because of his age, he was diagnosed with prostate cancer pretty soon after finding out he had that mutation. We can't know which one would have caused it because, but like I say, he was elderly. But after that, my aunt and my dad got tested, and my aunt was negative, didn't carry the mutation, but my dad did. So I'm the last to find out my result. And when you heard three negative results come before you, you kind of started to kind of think in my head, well, I don't like my chances. Um, but I was still, for me at that point, it was still very much okay, a what if. This could be something. I could have the mutation. When I got that phone call and I was at school, end of the day, and she said, I'm so sorry to tell you, but you do carry the mutation. I was a bit kind of taken aback, a bit gobsmacked, really. But then kind of I felt uneasy because the year before that I'd actually been seen for a lump in my breast, which turned out to be nothing. But we made the decision that I would go privately and have my breast checked. And that was quite a scary, found lots of different lumps in my breast. So I kind of came away having had like 4 biopsies in one go, all fine. And then there's no screening for ovarian cancer. But the best thing that I could do, which is what I did back in October 2015, was I had a CA125 check and an internal scan, which all looked fine. And the idea was that I would have that every year, or more for my own peace of mind than anything else. But I didn't get to that point because in May of 2016, I started to experience what I know now are all of the common symptoms of ovarian cancer, quite literally, one after the other. You know, I started with stomach cramps. I called the GP at that point, but my age, because of my age, ovarian cancer was the furthest thing from anybody's mind. And within a month, it kind of went from stomach cramps, constipation, bloating that didn't go, really bad back pain, lower back pain, and like needing to go to the toilet all the time. But like I say, that the reason why I suffered the misdiagnosis from 3 different doctors It's very rare, and if you had a lineup of women, I would stand out because of my age, but it happens, and we mustn't hide away from that. The second visit in A&E in 1 week resulted in them seeing that my infection marker within my body was through the roof. They did a CT scan, and that showed a swelling on my right ovary. Immediately, they were concerned that I had ovarian cancer. They wanted, but I was transferred because I was already under the care of a surgeon. I was transferred immediately to the Marsden. Seen that evening, the next morning I had a drain put in, and the reason why it was so bloated was because I was carrying 6.5 litres of ascites fluid in my abdomen. Very quickly, they did biopsies, and within a week, I was sitting in a chemotherapy chair, and I had weekly chemo. The weirdest thing is that when I remember back there, you know, I was being told you've got stage 3C ovarian cancer. This is going to happen. This is going to happen. The only thing I was able to focus on, you know, which I'm sure my dad will remember, is my hair. Oh my God, no one. I can't lose my hair. I can't. That can't happen. And Professor Martin Gore, who sadly has passed away now, was my first oncologist. And I remember meeting him for the first time, and he came into the room and he said, everyone's giving you bad news, but I'm going to give you some good news. He said, we're going to do chemotherapy every week, and we're going to save your hair. And he just gave me something to hold on to. And it was really, but ironically, at the end of the chemo, my eyebrows fell out and my hair thinned, and I didn't care. And I think I learned along the way from all of the people that I'd met, you know, elderly cancer patients who were older, particularly one woman who's sadly no longer with us. I met her on my second chemo, and she had lost her hair. She knew she was going to lose it, and she just turned to me. She said, "I'm going to rock baldness and embrace it." And she made me feel a little bit better about it if it did happen. And actually, knowing that every single Monday I was going to sit in front of a doctor was what I needed. I was always a bit of a health anxious young girl anyway. I'd cut myself and I'd freak out. You know, even to this day, I can do something which I know is completely fine. I'll call my dad and be like, "Is it okay? I cut myself." But it helped. It helped to be 27 and be seeing a doctor every week. So even I remember when I had a vomiting spell over one weekend, and I was convinced, oh gosh, it's bad again. Seeing the doctor on the Monday, she was like, "You drank how much orange juice in one weekend?" She was like, "That's why you." So it just helped. And at the after the 9 weeks of chemo, I was prepped for the very big radical debulking surgery. And I remember having the scan mid chemo, and my surgeon saying to me, "It's funny what you remember when you think back." He said, "You know, I knew the scan would look good at this point, but I didn't think it would look this good. And the chemo that they'd done before had really helped to shrink things down. And subsequently, that made their job in surgery easier." I had everything removed: tubes, ovaries, womb, 2/3 of my diaphragm. I had my bowel cleaned. I had my appendix out, one lymph node leading to the heart, just because they just weren't sure. I made I was prepped for being in hospital for a month. But that ended up, I was discharged on the 6th day. And I remember looking at my surgeon going, "Are you joking?" He's like, "Why would I be joking about you going home? Like, you're doing so well." I was out of intensive care quickly. I was up, walking. And it was a really big thing.
One thing that's really interesting about your story is, even though you knew you were BRCA and you were under surveillance, you saw 3 doctors who misdiagnosed you. So there's something there about what doctors don't know about BRCA that it would be very good to bring out.
Well, because I was discharged very quickly, and had a lot of support to get back on my feet. You know, physically after the operation, started chemo quicker than everybody thought. Had 9 weeks more, and then was. I remember like it was yesterday, really, sitting in front of Professor Gore and him saying I was in complete remission, and to go straight up to the chemo ward to start a year of 3 weekly Avastin as maintenance. Doing really, really well. I had 2.5 years clear, before I with it, and in that time I went back to work full time as a teacher. I met my now husband. Things were going amazingly well. We got engaged, and sadly, in the lead up to our wedding, around this time, actually 3 years ago, a suspected recurrence was found. But kind of in the words of, as my team has said to me, if you were going to get a recurrence, the one that I had was kind of what you want, because it was a very small 1 centimeter tumor that was found behind my bowel. They whipped it out in a 45-minute surgery. And chose to give me preventative chemo. And then because I'm a private patient, I was lucky to be able to go onto olaparib, a PARP inhibitor. And think about, how things have changed since 2016, because had the PARP inhibitor been something that was well known about and established at point, I very likely would have been put straight on a PARP after finishing that treatment. Thank God it's doing really well. I'm over 2 years clear of that recurrence. In that time, I have gone and made the decision and had a preventative double mastectomy, which again, I surprised myself. I bounced back from that surgery very quickly. So I have taken control of the breast cancer risk. My ongoing surveillance and maintenance treatment continues for ovarian cancer, but I'm lucky that can and happen. I think since that time, I've learnt a lot about myself. Thank God my CA125 has been really stable now. I know, every story is different, but I know my marker is very good at indicating even if there's just a chest infection. One thing I think I'm learning each day is to try to handle that health anxiety. And I'm very blessed that, I've got a wonderful husband, wonderful friends. My husband is also and very different to me, because he's he's as cool as a cucumber, and he was like that in his own treatment and the surveillance post treatment. We are, please God, going down the lines of adoption to build our family. And I'm, doing very well at work. I've become head of mental health in school. I am head of languages, working full time as a teacher. And recently I was actually awarded Alumni of the Year. I was awarded Alumni of the Year for Birmingham University for the fundraising and cancer awareness that I've done. And I'd say to anybody I hear, or anybody who has emailed my blog and said, you've got me thinking about I must stop avoiding or missing my smear tests, or actually I went to the I recognized symptoms after you spoke, and I went to the doctor and they found I had a cyst removed that was benign, but thank God you went. If anybody I know who talks to me about family history, I will be the first to go, have you considered testing for BRCA? Because knowing, and the fact that I knew about it before I was diagnosed, gave my team everything they needed. They didn't, if we didn't know, they would have done a BRCA test on me because I was so young, and it would have come out of the family through me. But thank God they didn't need to do that, because they knew then what targeted treatment would work for me. But anybody who has that, I know it's scary to find out about a potential gene mutation, but it is better to know, and it is better to be forearmed with the information. I only wish that I'd known before. I'd known about it younger. That would have meant, decisions. I wish that's why I would tell anybody who has that history taking that test, and not to be fearful of what happens, because look at what developments they're making each year, each day, maybe. I'm on something now that wasn't really a huge, as much of a thing back in 26. So I even say to my own sisters who don't have the gene mutation, you keep checking. It doesn't, you have to keep you have to keep checking, you have to keep on top of things. And I guess the thing I'm learning, but that's because of kind of what I've been through, is when something is normal, it's okay. Like normal things will happen, but you know, if there's something you're not sure about, check it, ask. And that's why I keep speaking. That's why
Yeah,
I continue to talk. And I want people to know that it is better to know about your genetic risks. It really,
yeah,
really is. It
yeah,
really is better. It gives you an opportunity to do something. And whilst I couldn't do the things that I could have done preventatively, prevent ovarian cancer, I did it for breast cancer. And I know that I will never sit in a chair being treated for breast cancer. Yeah, I
yeah,
have the other risks that I have to contend with, but you know, those, thank God, you know, I'm doing so well. So I'm
mm,
going
yeah.
with.
Look, amazing, and thank you for sharing that story. It's quite a story to listen to, and you are doing amazingly well. You know, it's just incredible. So, now you mentioned friends and family and all of that, and how important it has been to talk about it and to share that information. It would be great to bring in Jake, your dad here, to say a little bit about the impact on the family of this, well, diagnosis, but also finding out about BRCA and what you would like other families to be aware of.
Thank you. Um, if we go to the history first slightly, when we first started getting tested, my dad and his siblings, none of us really knew much about the situation. What we read in the papers, and that was about all. It was only when a few positive tests started coming out in the family that we started to research a little bit. Laura mainly was the catalyst for that pushing. Um, and it transpires that my grandfather, my father's dad, three or four of his sisters died from what was down in the death certificate as stomach cancer. This was in India. I was born in Bombay, came here when I was about 6 or 7. And when we'd mentioned this to Martin Gore, Professor Gore, we started to pry a little bit. I mean, I'm leaping forward now. And if we go back a step, those stomach cancer diagnoses very probably weren't. They were very probably ovarian cancer caused by a BRCA mutation. We firmly believe that, and Martin Core firmly believed that. Once I was tested, then obviously my 3 other children were negative. Laura was positive. The last thing that goes through your mind is, oh, someone's going to get cancer. It should do. It should go through your mind, but it didn't go through mine initially. So we did, as Laura test that she needed to do, and at that time, it didn't cross my mind that Laura should straight away go and have a double mastectomy. This was before the ovarian issue came up. I can't remember even discussing it with Laura. Do you want to have a mastectomy just in case? But then when she was diagnosed with the ovarian cancer, that it was too late to do that at that point. And then the impact becomes, oh Lord, you know, how great a risk is that, along with the cancer side? And the impact on everyone is huge. It's mad. You carry on doing normal things, whatever normal things are, and you have to do that. But underneath it all is, it's like turmoil, complete and utter turmoil. But the knowledge that you gain from reading, talking to people, that keeps you going. It completely kept us going. And Laura was very determined to not just poke around, but delve into getting knowledge. I remember we had a very, very, very fiery meeting with our GP practice, with the heads of the practice. It was a really fiery meeting about this is ridiculous that a girl, a woman comes in and I forget if she's BRCA or not, but if the symptoms even point to a, you know, slightly in the direction of, oh, you cannot just put it down to IBS or indigestion or stomach cramps or bloating. You just cannot do that. And it was a really fiery couple of hours, which ended in them changing their practice about how they would deal with stuff like this. Because she was very badly diagnosed, not just by the local GP, but by a gastroenterologist at a private hospital as well, who was completely out of whack. So it's the knowledge that I can't stress enough, that, you know, men, boys, girls, women, they have to get this knowledge and they have to talk about it. And this thing can, yeah, what happened to Laura was freak. She was 27. The breast cancer issue was the way it would have gone, but it freaked and it went to her ovaries. Now, the fact that she was a BRCA mutation, oddly enough, her surgeon, John Butler, and Professor Gould worked very closely together. That benefited her because the treatments are so advanced that when you're a BRCA mutation person, they know they don't have to guess at what course of treatment benefits.
Yeah.
So that fact was huge for us. As a family, the impact was huge, but like all families, or you pull together and you do it. But it's the learning. It's the learning about what could happen, what might happen, what probably will happen, and what definitely won't happen. And you put all those in a pot, you mix it up, and what comes out, hopefully, gets you forward. And that's what we did. That's how we played it. And the treatment side was pretty horrendous. You know, the first 9 weeks, then the operation, which was pretty big, really big actually, then more 9 weeks of chemo, and then when you get told you're in remission, you know, you think, oh, flipping it, that's amazing. And then the maintenance treatment, and when you're on that ward, when you're there and you're looking at the vast array of different people that come in with a gynecological cancer, you think this affects, you know, everybody. And then when you learn about the percentage that are BRCA mutated, it's quite shocking. It's high. It's very, very high. And I can't for the life of me understand people, even to this day, who know there is an inherent risk somewhere down their family, but choose not to get tested and think what we don't know won't hurt us. Well, they're a bit daft, really, because what you don't know can kill you, not just not hurt you. And Laura's blog is great for putting people into that situation. We've come all this way, and touch wood, the knowledge. If you read, if you learn, if you listen, if you speak with the intent of not just, oh, this will make me better, but I want to learn about it so I know all the risks, all the upsides, all the downsides, then you actually sleep better at night, thinking, I've got a chance here. I've got a chance to do something really, really positive. And I would stress on partners to just not take no for an answer, and it's just push, shout, scream, and get the test done if you think there is any chance. And if it's clear, and if it's not, at least you're armed with that knowledge of, yeah, I know what to do next. And I think over the last 3 or 4 years since all this kicked off, I've really noticed more and more people talking about it. My friends, my partner's friends, when we go to people, it's not like a taboo subject. They ask about Laura. We are very honest about the situation, and then they say, "Yeah, well, we spoke to a friend, and this happened, and we told them about this, and they got tested," which is a really, really, really good thing. Because if you don't go down that route, you're just mad, I
Mm.
think.
Yeah. Well,
Can
thank you.
can I just add that I think, like Dad was saying about people knowing and having that opportunity to know, and when you do have that BRCA status and you know that you have a mutation, and even if you don't, it's so important to stress to any GP. And actually, if I think back, actually, I knew my body. I
Mm.
knew that something was wrong.
Something was wrong.
That's what they needed to pick up on. They need to listen to the women, to the men who are saying something's not right, and they need to respond to that. And actually, that education, and maybe this is me speaking with the teacher hat on, but I'm thinking also of previous appeals that the Eva Pill have
Yeah.
done. That education has to start young. And actually, those children need to know. And I actually had a few conversations with some friends recently who were talking about. She was talking about how she, had speaking to others, and that I'm thinking of that campaign you did about young children and children being able to recognise the girls being able to recognise the names and what are those different parts called,
Mm.
how do they work, and taking away that stigma of using the words. No, I think you guys did a thing about how
Euphemism. Yeah.
yeah, taking that stigma away. Girls and boys should know what those parts are called. And I remember one time with my older sister, I was with her two children, and they were not using those names, and I taught them those names, which they then when I think are used in nursery. But it's so important because children have to grow up knowing those
Absolutely.
names, understanding them, and knowing that if there's something wrong, it's okay. And to go, okay, that doesn't feel quite right. And with a teacher hat on, I see the importance of arming children with that. And that's the same as somebody who has BRCA being able to say, I know my body, and I know that's not right. And if you start that education young enough, it follows you through, and you are firm, and and it gives you kind of more of a chance to say, no, I'm not taking that. I know.